June is Men's Mental Health Awareness Month and aims to raise awareness about an issue that's often overlooked. We also celebrate Juneteenth this month, commemorating the end of slavery in the U.S. and an occasion to celebrate Black culture and excellence. Joining me now is Calissa Ngozi, a mental health professional who has a unique perspective, on raising resilient Black boys. And thank you very much, Calissa, for joining us today.
Yes, thank you for having me.
How are your experiences fueling your current work as a mental health advocate for kids in foster care and for Black men?
Well, I think that I have twins. They're 10 years old and, they're biracial. So they're both black and white. So they draw on both cultures. And what's happening, I'm finding in society is there's a huge percentage of men who suffer with mental illness or have some form of mental health crisis, but there's such a stigma attached to it that they're the demographic that are not reaching out for help in the ways that they should. So I feel as a mom and as a mental health practitioner, it's my job to help them. It's my job to help them get resources. It's my job to help raise these boys into young men that are respectful, that understand how to deal with anger properly. I don't want to raise men that don't know that mental health is important, and so is speaking out.
It's still perceived as a weakness, isn't it?
Absolutely. It is shown as a weakness to cry out for help and say, listen, I'm not okay. And we're trying to change the narrative to say it's okay to not be okay. But then what's the next step? And a lot of times in these different communities, they don't know where to turn because in generational trauma, which is huge in society, they don't want to ask their mom and dad. They don't want to ask their grandparents. So who do they go to? So I think in the mental health community, we're really working hard at being inclusive and understanding and making sure that they have access to the resources needed to get help.
How do men need to be approached, or younger men or even boys, about mental health? Is it different than women?
Well, I think inherently men don't always like to show their emotions. And I think when they're younger, that's when we need to start tapping into it's okay to cry. It's okay to show emotion. It's okay to be upset, but showing them how to do it in a healthy way is how we're going to be able to change a trajectory to make men understand that mental health is okay.
And for kids, like your boys, how can we talk to our children, talk to our sons specifically? I have a 16-year-old. How can we talk to them to get them to open up?
Well, it starts at a young age because 16 years old, that's a little bit tougher because they've starting to coming to their own. They're 2 years from becoming an adult. So I think just letting them vent, letting them know that you are their safe space and that anything that they share with you, you're not going to get upset and you're going to give them the tools and strategies that they need to overcome whatever crisis they're going through in that moment. And the more that we talk about it as parents and the more that they see us being accepting, then the easier it'll be to have those conversations with them.
What would you like to see from governments to help make this easier for men?
Well, I think there needs to be a lot more publicity beyond just Men's Mental Health Month. We need to be going to these communities that are struggling and having these resources available. And I think we need to look at costs as well. Not everybody has access to benefits for things like counseling. So I think that we need to make sure that we have programs available for those that maybe are struggling financially. Because let's be honest, if it's between groceries or between going to counseling, they're going to pick groceries. So we need to make it more accessible.
Okay, Calissa, thank you very much for joining us today. We appreciate it.
Thank you.
Calissa Ngozi is a mental health professional.